Yeah. Okay. Over to you, Rudra, I think.
Okay, great. Thank you so much, Ellen. Thank you so much, colleagues. Warm greetings from Nairobi, and welcome everyone for this mega community of practice event. And this is the first time UNICEF is organizing this one, and I hope we are going to have more participants. I know nearly 480, 380 participants registered for this event, and this is going to be really mega one if more and more people going to join. And the topic of this community of practice is around early steps and giant leaps, scaling for the bright future. And with this, my name is Rudra, and I'm leading quality and learning for the region. And with me, Ellen is coordinating KIX, and we have Veronica. And I don't know whether Miriam is there or not. She is coordinating for the KIX Hub as well. We have Victoria from ICBA. David is going to present the main content. And we have also with us our regional advisor, Wangani. Uh, she is going to deliver the key message for this community of practice. And we can quickly go to the uh, next slide around the program. Let's see what presenting. Yeah. Okay, can you go to the next slide, David? We have a 90-minute slot, and within 90 minutes, okay, for this 90 minutes where we are covering the key content, this is going to be for 45 minutes and followed by 20 minutes interactive question and answer, where Ellen is going to lead that one, and following to that, key takeaways and also the closing that David and Victoria is going to take care of those sessions. And toward the end also, we are going to have some follow-up action, particularly making this a real community of practice. What are the support we can provide subsequent to this engagement? So this is about this 90-minute slot, and particularly this community of practice, we are going to cover again the scale-up framework and the scale-up models from our region and beyond that involves the continent as well. And we are going to share the insights and the impactful country practices. And in addition to that, we also going to share how countries going to adapt the country those models into the country context, particularly both in the scale-up exercise as well as the mainstreaming those practices into the national system. So these are the key things we are going to cover. Without further ado, I am handing over to Wangani, particularly for the key messages from sector.
Thank you. Good afternoon and good morning. Depends on which time zone you're working from. I'm quite honored to be part of this conversation because I know that I'm just a small piece in the bigger frame of the puzzle, but the people we work with on the ground are the ones that make everything possible. So again, welcome to this community of practice that is meeting today. And the title of the webinar today is very interesting. Early Steps, Giant Leaps, Scaling for a Brighter Future. And I couldn't put it much better than it has been put in this title for the webinar. Early steps are critical. I think there's a lot of evidence, a lot of science, and it's a fact that cannot be disputed that investment in the early years has the highest returns. And as we know, just $1 invested in early childhood education can yield 4 to 5 times return on investment. And this is the message we keep pushing in our advocacy with all the decision makers we work with all the partners that we work with, and all the structural communities across the region, from the economic communities, but also with the Africa Union, that it is important and critical to invest in the early years by investing in early childhood education. And we are building this year on a strong foundation that was put last year through the year of education to emphasize that early childhood education is important. And if we miss these critical steps, then we miss it for the future of Africa, because we know There's also a growing population of children, young people in this region, and it is critical that we invest today. But despite this, we also know we are facing significant challenges in this sector. Statistics at the moment show that only 30% of children on this continent are actually accessing early childhood education opportunities. But within that, we also have a lot of variations because the children that are the most marginalized, those at highest risk, for instance, children with disabilities, children from the poorest households, and children even from the poorest and rural communities, and children living in emergencies are the ones that are most left behind. And unless we register success in those marginalized communities, then our story remains incomplete. Yet, despite these gaps, we know governments are only allocating about 2% of the expenditure to early childhood education. And our message has been, we need at least, at a minimum, 10% of the education budgets to be targeted towards early childhood education. At the same time, we also see a lot of fragmentation in terms of coordination, with early childhood education being located in several ministries. And we are here to support how we can actually work together to do better. Worse still, we have a very limited workforce. And where even we have a workforce, it is not trained to the expectation that we want for them to deliver quality early childhood education. And we need to emphasize that message. Specifically within this particular region, one of the key things that we have come to agree on, and we are all working on collaboratively in moving forward, is that as much as we call for increased investment in early childhood education, as much as we say we want more workforce, we want more equity in terms of distribution of resources, what are some of the key evidence-based, scalable, impactful approaches that are going to make the difference? So it's one thing to invest in a multiplicity of early childhood education, but it is also one thing to invest on approaches where we have evidence that it works, it's costed, but it can also be taken to scale at the system level by the governments, which we rely on to reach every child. And so what we are trying to do is to compile what we are seeing from the region, from the continent, as some of those evidence-based approaches. And we are seeing a couple of them emerging. For instance, we have community-based childcare approaches that are emerging in Malawi that are quite promising in terms of early childhood education and to reach even the most marginalized children. And we are seeing increase in terms of enrollment. Malawi alone, actually, participation in ECE by just adopting this approach increased from 4% from 2002 to now about 50% in 2022, which means it's doable, it can work. We are also seeing approaches related to accelerated school readiness, which is a compressed time frame in which you can provide ECE education. And some of these approaches are emerging in Ethiopia, Mozambique, and are also showing that once children have the opportunity to get into these accelerated school readiness program, they are almost 100% assurance that they will actually transition to primary one. So we're looking at scaling some of these opportunities. And then, of course, play-based programs in Rwanda, South Africa, and I'm sure there are so many of them in Ghana, in Uganda. We've heard about some of these approaches, and even in West African countries, we've heard about some of these approaches. And our message is really to emphasize on those evidence-based, costed, and scalable approaches to reach every child. And this is why our community of practice and the people meeting today will become critical, because this is a space where we can share this learning, we can share these best practices, and we can agree on some of these models to really take early childhood education to to scale. And I'm very grateful to the partnership that we share within the KIX community with our counterparts from UNESCO ICBA, but also from the African Union, IPAID, and all the partners and also country focal points who come together to join us in this mission. And I'm hoping that this community of practice will continue to grow and continue to share these experiences so that as we near SDG in the next 4 or 5 years, we'll have a different story to tell. So wishing you the best in this meeting. I wish I could stay for the whole of it, but I'll stay as much as I can and then have to move on to another commitment. But I know our colleagues from ICBA, our colleagues from AU, and also other colleagues from UNICEF who have supported to pull this together, for whom I'm very grateful, will be here to support this to its end. So thank you very much and wishing you the best. Thank you.
Thank you. Thank you so very much, Wangani, for those insights and also sensitizing the community on the investment on ECE and also for your forward-looking reflection on the evidence-based impactful practices and the importance of scaling of those practices and integration into the national system. Thank you so much, Wangani, once again. And with this, I'm inviting David. David, can you hear us? Okay, you are there. David is our ECE specialist and leading this content and supporting countries both in the SRO and worker in the continent to supporting to moving this agenda forward. Over to you, David, for your presentation and interaction with the participants.
Thank you, Rudra, and it's a pleasure to meet all of you again. I hope you can see my slide from wherever you are.
Yes.
Good. So today is such a very unique day. And this basically is more about advocacy, is more about sharing light on the different programs that we have in terms of early childhood education. For some reason, are you still seeing my slide?
We see. It's the last slide that you are showing. So you can go on the first, yes, and you can click on, the screen that is actually cut in diagonal. And there is a button on the bottom, I think. It will enable us to show the full screen, maybe. But now we're on the slide of the agenda of the meeting.
Okay.
If not, I can try to share my screen from my side.
Okay, good. So Rudra has shared with us some of the housekeeping issues that we will observe during this webinar. And so I would basically go straight into the presentation, which is the main thing we are here for today. So let's give a background to this. There has been increasing advocacy and momentum building over the last 10 years relative to pre-primary education. We saw that effort being amplified by the integration of pre-primary education in the SDG goal 4.2 at the global level. We also saw that being amplified when the Global Partnership for Education incorporated pre-primary as a critical pillar for investment within countries. And then when we saw that the G20 basically included pre-primary as part of their agenda. So over the last 10 years, we've seen momentum building globally and also regionally. However, this momentum has not really yielded the results that we all anticipated as we close in on 2030. So currently, just about 50% of kids in Eastern and Southern Africa have structural education in the year before starting primary education. And so we are talking about that 1 year before pre-primary education. For some countries, it's age 5 to 6. For others, is age 6 to 7, and for others is age 4 to 5. So depending on your context, that's what it is. We also see across countries that there's disparity even with about the 50% in some countries is very, very low, while in other countries progress have been made. So the essence of this framework is to show light on models that are basically being used across countries and being used for skill, and to also provide guidance on how we plan for skill in pre-primary education.
David, your slide are not moving. Can you unshare? I'm going to share from my side.
It's not moving.
No.
Okay. Okay. Can you share? Good.
Can you see now?
Yes.
Okay.
Okay. And we also saw that in 2022, UNESCO came up with some evidence that basically reveals that 1 in 4 children are not in education during the year before the official school age, and that 4 in 10 children are not in education during the period countries expect them to be in school, and just 3 in 10 countries have set at least 1 year of pre-primary education as compulsory. Next. Good. So what is UNICEF commitment? UNICEF commitment is in threefold. One, that all children have access to at least 1 year of quality pre-primary education, that priority to marginalized children, including those affected by emergency, is high on the agenda, and that at least 10% of education resources are committed and expanded for pre-primary education, because often we've seen that there's a difference between commitment and disbursement. In some cases, we have commitment, but we don't have the disbursement. So this is critical. Next slide. So what's the objective of this framework that has been developed, and hopefully very soon will be shared with you all in both Word and PDF? The objectives of this framework is to identify, analyze, document, and share within ECE countries cost-effective pre-primary models that could be considered for skill. Identify the key factors needed for skill in pre-primary models, and provide a step-by-step guide to planning for the skill of pre-primary models. What we've seen over the last 5 years in ECE is that many countries have already done the national diagnostics of pre-primary education. They now understand where they are. They understand the different system areas that need to be strengthened. They now understand the enabling environment factors that needs to be considered. And so a lot of the countries now are anticipating skilling pre-primary services, and this framework become expedient to facilitate that process of skill, like we've seen on the screen. Next. So skill up mothers. Next. What do we know? Currently, based on the 2023-2024 mapping that was done in ECE, we know that only 38% of countries in ECE indicated having costed ECE scale-up plans. That was indicated, only 38%. And 1 year of reception class was the most scale-up model being followed by many of the countries. And we also understand that there are different models being considered for skill in ECE. You can see we have the 1 year reception or O class. We have community centers. We have 2 years program. We have the accelerated school readiness. We have 3 years program. We have the home visitors program. We have satellite centers, especially for pastoralists in some of the countries. And then we have ECE hubs. But of all the models that were listed, 1 year reception or O class seemed to be the dominant model that's being considered for skill. Next. So what examples have we identified relative to skilling quality and inclusive pre-primary education. We've identified the accelerated school readiness model. This model has been tested in Ethiopia and Mozambique. The program targets in Ethiopia 6 years old children without previously learning experience. And the duration is for 8 weeks for a total of 150 hours. What we now know is that the program improves children emotional, cognitive, social, physical, and literacy readiness based on a comprehensive evaluation that was conducted. What I've heard around countries most often when I visit is that will 8 weeks be enough to ensure school readiness? That's the question often that comes up. My colleagues from Ethiopia are here. They will also show some light on this. But what we now know is that yes, school readiness can be achieved within this 8 week based on a structured program that is provided. In Mozambique, is used as a summer program comprising capacity building of school councils and community-based education professionals and parent-to-parent education sections. And this has also been tested now in Mozambique. What we now know that a highly significant impact on the overall school readiness of children using the Adela score increased by 17 points. So this is another evidence that demonstrate that the accelerated school readiness program or model actually enhances and ensures school readiness. Next slide. We also know for the 1 year reception class that we see in the Zambia and in Ethiopia is called O class. In other areas is called different names. In Lesotho, it has a different name. But what we now know is that this 1 year reception class basically constitutes a model that requires classroom construction, early learning, family engagement, teacher training, and the program targets children aged 5 to 6 years old. What's the impact on learning? Students who are undergoing the program outperform their peers by 5% based on a study conducted in 2021 by Sanders. The program enhanced motor development, emerging literacy, social and emotional development, and emerging literacy skills of the children who attended the program. The reach may be far above or have exceeded this number on the screen, but we know that's the model be considered for skill. But also just to throw light on Zambia, Zambia comes a long way. Zambia followed a trend of doing a national diagnostics that was first done. They went on to use the diagnostics report to develop a pre-primary subsector plan. Once that plan was developed, along with that plan, they developed the school readiness assessment framework and the tools. As that was done, then it was being now, all of those were taken to inform the provision of this reception class simultaneously. So Zambia has some very good lessons that we can also learn relative to the 1 year reception class. And Ethiopia has some very good lessons that we can learn from the 1 year O class. Next slide. So cost effectiveness. This is one of the most critical elements when you are considering a model to scale. So we basically have 6 models here today. And you can see them on the right hand, the 6. So we look at one, the accelerated school readiness. But before looking at that, we now have evidence that low and middle income countries are spending roughly about US $325 on average annually per student enrolled in public pre-primary education. So hold this factor constant, and one may ask, but what's the driver of this amount? So overall, the main driver of this amount is teachers' salary, teachers' compensation. And in most cases, teachers' compensation is the key that is not complemented by teaching learning resources, by play materials, by a very structured learning environment. So this also has to be considered in quotation mark, the 325, as we now know. So let's look at the accelerated school readiness. Based on the evidence from Ethiopia and Mozambique, it's estimated in Ethiopia to be around $25 to $30 per child to offer the accelerated school readiness program. And in Mozambique, it's estimated around $60 per child. Again, like I said, cost should be considered in context. You will see that in Mozambique, other elements were included that are not in the Ethiopian model. So depending on the context and how you want to proceed, you can add, you can subtract, but at the end of the day, the goal is to ensure school readiness. So when compared with the average amount for public pre-primary service, you can see that the accelerated school readiness model offers a far lower cost for school readiness. Reception class. At the moment, we don't have a unit cost for the reception class or O class because it seems to vary across countries. In some countries, they use available infrastructure. In other countries, they are annexing one classroom to existing primary schools. In other countries, they are demarcating classrooms to share with grade 1. So we don't at the moment have what the actual cost is. However, a report from the Ministry of Education in the Zambia, funded by the Royal Federal Foundation, reveals that the targeted one-year pre-primary education exposure emerges as a more viable option in response to a budget constraint in view of the traditional 3 years program. So this is one area we are still doing further detailed research to really understand what the unit cost is, and we cannot get a fixed unit cost because services, programs, and cost for personnel varies across countries. Then we have the CBCC, the community-based child care centers in Malawi. Here is estimated around $147 for the provision of this service. But of this amount, 34% of this 147 accounts for school meals. Now, this is a community-driven approach, a community-driven model. This model is owned by the community, is supported by the community, volunteers are recruited from the community, and parents contribute quota of meals to support school feeding and nutrition within these centers. And depending on the context, different interventions have been made to support communities in achieving this goal. Our colleagues from Malawi are on the call and they will be here to show some lights. But what I've found out doing visits to some of these centers is that it is highly, highly, highly sustainable because of the community ownership. Then we have the BRAC community-based ECD model. It's still not clear what the actual unit cost is for the model, but most research considers the model to be cost effective. This is another area that we are still doing some more work, but it's similar to that of the CBCC in terms of costing based on what we know now. Then there's another unique program we found in Kenya called Kidogo. Kidogo centers in Kenya basically are in the slums of Kenya and offer care, education, and nourishment to about 30 to 50 young children that are basically cared for by women. And those women are called mamapreneurs. They are trained in the approach and how to provide the care. The average cost that we now know is that it costs about $1 per day. And when you take that to a month, it costs around $30 a month. There are other costs associated, the initial startup cost, the material costs, but those are embedded within the overall cost over time that those mamapreneurs have to pay over time. Then we have the home visiting program that we now see mostly in Australia, in America, in Korea, but also in Liberia. Of all the costs indicated on your screen, this seems to be the highest of the cost. But then again, consider this in context. So let's use Liberia as an example. In Liberia, the unit cost for a child in public pre-primary school is estimated at around $2,000, mainly driven by the cost of personnel. Because personnel are paid between 175 US dollars to 300 US dollars per month. So just taking that cost alone reveals how much a child cost in public pre-primary service. So this home visiting program is inclusive of parental education. So because parents support the learning of children using this program, so the program targets the child and the parent. Where parents are not literate, the program provides literacy for parents to support their children. So the overall cost of this program is around 451 US dollars. Now, the argument by proponents of this model is that in a context like Liberia, where the government spends around $2,000, and these programs provide you $451, but it targets both the child and the parent, it seems to be cost effective within their mindset and within the context in which it exists. Next slide. Good. So let's look at the effectiveness and the school readiness of the model. What we now know, based on the International Journal of Innovation Research in Education, that the Accelerated School Readiness Program achieve higher level of school readiness. And beyond that, it also ensures physical readiness, normative readiness, cognitive readiness, social readiness, and emotional readiness. So social emotional learning is also embedded within the model that ensures social readiness and emotional readiness of children. In Mozambique, the American Institute of Research also found a highly significant effect on children overall school readiness using the Adela evaluation in areas of emerging numeracy, emerging literacy, executive function, motor skills, and approaches to learning. So we now have evidence that the accelerated school readiness model ensures school readiness and is also cost effective. Now, reception or O class. In Ethiopia, the University of Cambridge reported in 2022 that the O class participant outperformed children not enrolled in any pre-primary school by 8 percentage points on average, with greater learning gains in early numeracy for the period under review. That's 2019 to 2021. So we also now have evidence about the effectiveness of the O class in Ethiopia that we can also gain lessons from. Now, the community-based child care center in Malawi, we still don't have empirical evidence. However, Action Aid, one of the implementing partners within country that have done extensive work, found that children who attended the CBCC and went on to primary school outperformed children who never attended CBCC. Next slide. BRAC. Several studies have been conducted about the effectiveness of the BRAC model, and across Bangladesh to India to Uganda to Tanzania, there's now evidence that this model ensures school readiness. And also the Kidogo model, based on a research conducted by Aga Khan, reveals that this model also ensures school readiness, and beyond school readiness, it also ensures executive functions and emotional skills. The home visiting program. So there's a whole evaluation package called the Bracken School Readiness Assessment. It was used in the Liberian model to understand to what extent outcomes are achieved by this model. And this model found significant learning outcomes or gains compared to children who did not enroll in home visits program. What this model also found was that children who attended the school-based pre-primary and children who attended the home-based pre-primary, often the home-based pre-primary children outperformed those children who were in the structured school-based program, and they went on to excel. So we now see from different angles the results or effectiveness of this model. Next slide. So, knowing some of these models, and some of these models are already being practiced in our countries. So how do we now take on any of these models for consideration as it relates to skill? So countries first need to come to the point to understand that none of these models will be as successful if the enabling environment and the system needed to facilitate skill are not in place. So countries need to understand, one, that we need the enabling environment to facilitate skill up. And when we speak of the enabling environment, what are we speaking of? We are speaking of policies and legislations. We are speaking of leadership. We are speaking of financing. We are speaking of public demand. We've seen across countries in East and Southern Africa where pre-primary education is not free, it's not compulsory. The statistics will be out very soon when we launch the mapping report. You will see the number of countries that do not provide free pre-primary, and that pre-primary is not compulsory in those countries. So in contexts like that, it makes it difficult to scale. Then in other countries, we've seen that pre-primary is established in the national education policy as a subsector without any ministerial leadership or anchor within the Ministry of Education. It's still submerged under the Bureau or Department of Primary Education. We've also seen countries where there's very limited, little to no financing. Wangani told you, on average, we've seen 2% of education budget being spent on pre-primary education. Without domestic financing, it becomes difficult to scale. And in other contexts, we've also seen that there is very limited public demand. Parents don't understand the value of pre-primary education. There's no demand for services. In some contexts, we've seen government have made efforts even in constructing classrooms, but parents are not utilizing the services because they don't understand the value and the outcomes that pre-primary education produces. So these are the 4 elements of the enabling environment. And then we come to the system area. When you think of scaling any pre-primary service or model, you need to be able to plan for that model. You need to ensure that you have the right curriculum for that model. What we now know across East and Southern Africa is that most of the curriculum we have are either 10 to 15 years older, and they need revision. And in some countries, we don't have a national standard curriculum for pre-primary education. So these are issues that we need to be able to deal with when we think of skilling. Workforce is another critical area. What we now know is that in most countries, the pre-primary workforce is not considered as part of the education workforce, and to a large extent are not on the government payroll. So in contexts like these, it becomes difficult to scale pre-primary services. Family and community engagement is another system that is needed. Quality assurance is another system that is needed when you think of scaling pre-primary services. Next slide. So there are subsector building principles that needs to be considered when you think of skill. When you think of skill, think about equity, think about inclusion, think about diversity, right? There are different locations, there are different people groups, there are different economic social groups. We need to think about equity. We also need to think about efficiency in terms of cost, because if it is not affordable, the service will not be demanded by the public. We also need to think about flexibilities. Country contexts and cultures differ greatly. So one model as is in one context, when scaling in another context, may not definitely follow the same pattern, structure, and approaches in another context. We also need to think about responsiveness. The design of pre-primary systems and services takes and likely changes in national and local context. So probably the way we might even offer this service in urban area might be a little bit different from the way we offer it in rural areas. So we need to think about responsiveness, also coordination between central and local government, between government and multilateral partners, between government, multilateral partners, and the private sector. We need to think about all of these coordination issues. Also within government, we need to think about coordination between the Ministry of Education, Ministry of Health, Social Protection, Gender, because they all have part to play in pre-primary services. Next slide. So what are the step-by-step guidance we have for you when it comes to skilling pre-primary services? Step one is assess the current pre-primary landscape nationally. Before you move to skill, you need to do a detailed assessment of the landscape of pre-primary education. You need to assess the problem. What are the problems associated with pre-primary services? What's hindering skill up? Why there's no public demand? Why government is not allocating resources? We need to understand the problem. Two, we need to understand the intervention to be skilled. What is it we want to skill? Is that a relevant model for the context? Is that applicable? Is that applicable culturally? Is that applicable socially? We need to understand all of these intricacies when we think of skilling. Assess the strategic or political context. Assess evidence of effectiveness. Assess the intervention cost and benefit. When we do an assessment of the landscape, these are some of the critical elements that we consider in assessing the landscape for pre-primary skill. Next. Step number two, we have to define the objective for skilling and the element to skill. What's the objective for skilling pre-primary services? And we also need to identify the elements to skill. It's possible that we may not skill the entirety of a model. It's possible that we may just skill a portion of the model. So we need to be very clear on what element needs to be skilled. And to do that, you need to understand what part of the model needs to be skilled, the time frame, what is the period for this phase, the target group, who are you targeting, the geographies, where are you hoping to skill this program, and the method, what method or pathway will be tested in skilling this program. So we need to define the objective, we need to identify what element we want to scale. Next slide. Number three, once we've done the assessment and we make the determination, we need to develop strategies and operational plans for the intervention. So we need to basically consider the fidelity and adaptation. Examine if the model or intervention to be skilled needs to be modified or adapted, and whether it will be skilled entirely or in part. This is where we come with that strategy to determine what is it we want to do. Then reach and acceptability. At this stage of planning, determine the target population and the method by which they will be chosen for the intervention are essential. Because most often we just identify the model and we assume that that model will be skilled and it will be well in a particular local context without even considering the social cultural dynamics of the context. Then the delivery setting and workforce. At this stage, we need to understand what's the setting in which this will be delivered. Can it be done in a community? Can it be done in a school building? Can it be done in a community center? The location in terms of the setting. What exactly are we looking at? Now, we need to understand sometimes within a country, we have areas that are stable and we have areas that are not stable. So there are conflict zones within countries and there are stable areas within countries. We need to understand all of these dynamics when we think of the strategies that we use to scale. It's possible we might have strategies for one part of the country and another strategy for another part of the country. Next. Then we continue with strategies. We also need to understand implementation infrastructure and learning materials. These are critical. Sometimes models are determined to be skilled without determining what are the teaching, learning, play materials that are needed to accompany the model. And we go on to skill and these are absent, undermining quality. So this is another critical element. Then we need to think about sustainability and ownership. Who's going to sustain the intervention at scale? Who's going to own the process at scale? So we now know that, for example, in Malawi, the communities own the process. It's going on after several years because communities are integral part of the model. Next slide. So number 4, once we've done all of that, we need to develop a theory of change and results framework. We need to know what results looks like and how change will take place. Because if we at the scale, we don't know what results we want to achieve and how change will take place. So we need to define the goal and objective of the intervention. We need to identify opportunities to benefit the target group. We need to define how changing the ecosystem will create these opportunities. We need to set up assumptions and contextual factors. We need to define areas of intervention, and we need to identify indicators for change. This basically constitutes what we mean by develop a theory of change and results framework. Next. We also need to embed within the whole planning process, monitoring, assessment, and evaluation. We need to understand progress. We need to measure input processes and outputs all through the period because we have to learn. The learning we gather from this process would inform changes, tweaking, modification that we need to embed into the system to ensure quality at scale. So M&E is a critical element in planning for scale. I have seen some scaled up plans without results framework, without an M&E strategy, without indicator to measure. And I've seen scaled up plans without budget and cost. So these are critical elements that needs to be considered. Next slide. So scaling up quality and inclusive pre-primary education, what are our observations? What we now know, what we've seen, what can we say to you about this? Number 1, we now know that in countries with legislations and implementation of free and compulsory pre-primary education, we see greater public demand and more marginalized children benefiting from services. We've seen that in Kenya and across Tanzania. We also know that in countries with diversified pre-primary model, we are seeing an acceleration in access, where the country has adopted several models depending on the context within country. We've seen this in Ethiopia, for example, with the accelerated school readiness, the old class, the child-to-child, and the formal pre-primary model. We've seen that in Mozambique. We've seen that in Malawi. We also know that in countries where spending is between 7 to 19% of the education budget on pre-primary, we are seeing stronger systems, improve quality and access, and improve school readiness. We see that across Eritrea, Kenya, Tanzania, Zimbabwe, and South Sudan. Finally, in countries with scaled up plans for pre-primary, like Zambia, Botswana, we see that increase in access is well balanced with the quality of services provided. Colleagues, expanding access to ECE without sufficient quality constitute an inefficient use of limited resources that may bring about negligible or even detrimental effects on learning. So when we think of skill, we have to think holistically. Next. So, having said this, there are reflective questions. There are things to ponder on. 1, how can we ensure that pre-primary education reaches the most marginalized and vulnerable children? How can we ensure quality pre-primary education skill across all geographic locations? How can we attract and retain qualified and motivated teachers for skill-up interventions? Are there clear policies and framework in place to support the skilling of pre-primary education? How can governments, NGOs, and private sector partners collaborate effectively to skill pre-primary education? What funding mechanisms are available, and are they sufficient to support sustainable skill? How can data and evidence be used to inform policy decision and track progress? What infrastructure is needed to support the expansion of pre-primary education? What mechanisms are in place to monitor the quality of pre-primary education at scale? What role can local governments and communities play in sustaining these programs? How can pre-primary education program be designed to meet the needs of children with disabilities or special needs? How can pre-primary programs be adapted to different contexts, such as rural or urban setting? When you think of skills, these are critical reflective questions that you need to consider. Next slide. Colleagues, increased investment in early childhood education starts with the most deprived. If we change the beginning of the story, we will change the whole story. Thank you. At this
David,
time,
Yeah.
a huge round of applause to you, your comprehensive presentation. Thank you again for sensitizing our community on the key data points, the step-by-step models, and your reflective questions. Then with this, over to you, Ellen, for facilitating the question and answer session. I would see there are a few questions in the chat. So, and this is very much aligned to your reflection question, David. Over to you, Ellen.
Thank you very much. All right, my name is Hélène Cron. I am education specialist at UNICEF Regional Office, and I'm also the KIX focal point for UNICEF ESAHO. And I will facilitate, the Q&A with David, and we would like you to come with your questions, any reflection that you have in your country, regarding David's presentation. I think Veronica has also shared, but maybe I will let her maybe talk about the survey she has posted. We would like you to respond to some questions. Over to you, Veronica.
Thank you so much, Helen. So I've shared the link in the chat box. So I would like to get the opinion or reviews on how ECE practices are being carried out in your countries. So the purpose of this survey is just to gather this feedback and also see how we as a KIX hub, we can be able to support your country offices when they are scaling up most of these models that have been shared by David. So looking forward to hearing and seeing your responses. Over to you, Ellen.
Thank you very much. So this survey is actually a way also to engage with you, to know where you are at. If you are planning, to also look at what you can scale up in your country, how the hub, the KIX 19 hub can support. David is part of our team, and he is available in the next month or so to come to support either remotely. And so, of course, it should be planned together with the KIX focal point within the country. But we are really eager to hear from you. So I don't know if there is any people who has actually raised hand, but I see a couple of questions in the chat that has actually been posted before David's presentation. So I'm sure David has already, covered most of it. But I'm seeing maybe, so I'm reading them. What are the most effective strategies for expanding access to quality pre-primary education across our country? How can a scalable framework for early childhood education be developed to suit different national contexts within the region? So I think David has talked a lot about, different models. Maybe there are others, and we are happy also to hear from any of your, experience. What are some successful models of scaling early education in low and middle income countries, and how can this insight be applied to ESA countries. So we have also heard about a couple of successful models. Why is early childhood education considered a critical foundation for lifelong learning, growth, and development, and how can its importance be communicated effectively to stakeholders? Maybe this can be a bit covered, particularly on how to, to communicate to a broader audience and to, communities and parents. Maybe David, you can also maybe give some element here, though I think we have talked a bit about, the critical foundation that is offered by ECE. And then lastly, how can key stakeholders such as policymakers, educators, international organizations, and community leaders be engaged to support the scaling of early education efforts? So basically, how we can come together, complement each other to support scaling effort from the government. Maybe I would like to ask David if you want to already cover those two aspects before we can go to other questions. I see that some are coming. Please continue to post your questions. In case we can have also some live question, we would be also happy to have some interaction participant to come and ask question orally. David, if you are still here, please, over to you.
Thank you, Helen. The questions I see that from 1 to 3 have been basically covered in the presentation. If we take question 4, why is early childhood education considered a critical foundation for lifelong learning? This is the way I often put it, right? Who builds a house and starts with the roof? Everything that is built from the ground has a foundation. And the foundation of education is pre-primary education. Without building that foundation, neglecting that foundation, obviously we create structural problem for the education system and the child beyond pre-primary. So this is the way I say it. Sometimes when you look at a building that has been constructed, and after a few years, you start to see cracks all in the walls. And then you see engineers try to find way to patch it and make it look smooth. But those cracks are structural cracks. Some of them come from as far as the foundation. So how is that related to this question? Now, you have education systems that neglect pre-primary education. And by the time children are getting up to secondary education, they are having remedial classes to help them pass standard exams. Those are cracks. If the education system was solid from its foundation, we wouldn't be having need for remedial classes to prepare students to pass standard exams. No. What are some of the cracks? High repetition rate, high dropout rates. Evidence shows that having quality pre-primary education can avert dropout rates in subsequent years. So these are some of the very, very reasons why pre-primary education is important. And how can we communicate effectively to stakeholders is by collaboration, bringing stakeholders together. I'll give you one example. In one country, I know colleagues from that country are here on the call. It was even difficult to understand the difference between pre-primary education and early childhood development. It was considered to be the same. And so it was difficult to collaborate with other partners because the partners on the one hand had a different understanding and the colleagues from the government had a different understanding. And they consider early childhood development as early childhood education, and any intervention without the 5 components of the nurturing care framework was not early childhood education. But by bringing stakeholders together in one room and having a conversation, that became very clear. And that country went on to develop a national pre-primary policy, strategy, and advocacy framework just for pre-primary education. because the understanding was now clear. So using a national stakeholder forum, national diagnostics are opportunities to really bring stakeholders around the table to have a shared vision. How can key stakeholders such as policymakers, educators, international organizations and community leaders be engaged? We've used several approaches, right? We have direct engagement with government ministries. We also have direct engagement with partners. And I'll give a few examples. In Mozambique, for example, when we did the national diagnostics, we were able to collaborate with UNESCO. We were able to collaborate with all the other international NGOs, and we're able to bring everybody around the table. And in South Sudan, we were able to work with USAID, and we partner with the World Bank to carry on that diagnostics. And it was the first time that the World Bank funded a program out of that diagnostic report in South Sudan, focusing on community engagement. So there are different approaches we can use to bring stakeholders together around these common efforts to scale.
Thank you so much, David. So, colleagues, you have understood from David's presentation that this scalability framework is now available. I understand that it will be released in few weeks. It's an opportunity to be guided to go through this whole process of assessing where your country is at and what to do to scale up those effective intervention. So do not hesitate to reach out. I see other questions that are coming, but before that, David, you have mentioned that there are some countries that are here in the call, particularly colleagues from Ethiopia and Malawi that may that you have invited to come and maybe say a few words and share their experience. Do you want us to call them?
Yeah.
Yes.
Yeah.
So I would request maybe Veronica to help us identify those colleagues so that we can give them the opportunity to unmute.
Sure, maybe someone can raise their hands up and then I'll just give access.
Do you have the name, David, by any chance?
No, they are basically colleagues from the country offices.
Oh, UNICEF.
Just before that, I have just one clarification, and particularly the resources we shared now. This is going to be shared with all of you, not just restricted to countries in Eastern and Southern Africa. These resources are going to be shared with all countries across. Thank you, Anu.
Thank you.
Thank you. I can see that we have Osman who is here, so maybe he can say something, and then we have Sadiq Hure who will come after Osman.
Okay, Usman, please, over to you. Please introduce yourself first, and you can share briefly what you want to share. Are you able to unmute? That's the point. I see. Yeah?
Hello.
Yes, please.
Good afternoon from my end. I am Usman BK Jao at the Ministry of Basic and Secondary Education in the Gambia, a senior education officer. I'm following this, and I thank David for answering my questions. I am really very pleased with the way he answered it. It has given me a new dimension of the way I was thinking around it, but he have made it very clear, particularly about the issue of number 5, the policy issues. Sometimes in Africa, it's complicated. But the way he answered it, I'm really satisfied. I think he have cleared my doubt. That's what I wanted to find out. But fortunately for me, David have made my day. Thank you.
Thank you for those words of appreciation. Thank you so much to the Gambia team. Over to you, Sadiq.
Thank you, Helen and Veronica and
yes,
David.
Please introduce yourself.
Panel. Okay, so my name is Sadiq. I'm joining you from Mogadishu, and very excited to be here. So my question is, I was asking, I come from communities where, education is very much, interested in, it's everybody's main business. But still, communities recovering from crisis, systems are a challenge. So my question was, are there specific specialized trainings for caregivers in ECE, especially in contexts where communities are recovering from conflict, prolonged conflict? That's my first question. My second question is, uh, now that is there any research that speaks to access to ECE in fragile contexts? Thank you.
Great, thank you very much. Maybe David, would you like to take those two questions? And maybe I would like to propose to give the floor after that to our colleagues from Kenya, particularly on the question around the evolution of ECE to regions and maybe the issues of equities that is related to that, maybe after the response of David. David, over to you.
Okay, thank you. And I think Mogadishu presents a very unique situation, and I think also growing up in a conflict affected country and emerging out of 14 years of civil war, and how we were able to achieve one of the highest gross enrollment rate in West Africa, Liberia specifically. Maybe those lessons could be vital for you in Mogadishu. So we need to dissect it a little bit. So we have issues of childcare, and we have issues of pre-primary education. So there are still children who have not reached the age of enrollment. Each country has defined the age of enrollment, but we have children also who are orphans and stuff who have not reached the age of enrollment. What do we do with those kinds of kids? That's where childcare become relevant. And in those cases, there are community approaches that can be used for childcare, giving communities the ownership and responsibility with technical support around training on caregiving. That's where it becomes relevant. Now, when we look at specifically the early learning component, especially we know that conflict, tension has impact on brain development. Children who grow up in conflict settings, they have several disadvantages when it comes to learning. And we need to think more of social emotional learning in those kinds of settings. So what we now know is that there are several emerging skills that are relevant for children coming out of conflict settings when it comes to pre-primary education. And those skills are relevant. In another study that we did for 2 years in conflict settings, I could share some of those in the framework, because what this is helping me now is understanding some other important elements to add into the framework before we can share them. So that for me will be one, focus on social emotional learning and understand what those social emotional learning skills are, and then embed them within curriculum systems and structures. The other thing you need to look at from a system perspective is to clearly define what pre-primary education is for the country. In the case of Liberia, we were basically able to establish it as a subsector within the Ministry of Education. We developed the national policy for it. We enacted it into the education law. We established a bureau specifically for it that had clear mandate and structure, working with county governments and provincial governments around establishing services for early childhood that enabled the country to address those issues, especially in a post-conflict nation. Now, in cases of access, like I said, what we now know is that no one model can ensure access across the country, because there are different people groups. In one country, you have pastoralists, you have people who are on the move. How can you design a program to address their specific contextual realities, because their contextual realities also have economic implications. And because of livelihood issues, they may not necessarily want to subscribe to a standard model. So you need to work with them and design a program that fit their context. So incorporating different models can help address the issue of access.
Thank you very much, David. Lots of other questions that are coming in the Q&A, but please help me, Veronica, if you are able to give the floor to Dr. Florence Itegi, if she wants to ask the question and maybe share just a few insights from Kenya and particularly the evolution of ECE to region. That would be great.
Dr. Florence, you're welcome. I've already allowed you the floor.
You can unmute if you feel comfortable to share. Otherwise, I can just read your comment.
Can you hear me?
Yes, please go ahead.
Okay, thank
Introduce
you
yourself.
everyone for those very insightful comments from Kenyatta University, and I enjoyed the discussion. I just felt it touches on us in Kenya because early childhood education is devolved. It is managed by the counties, unlike the other sectors like primary and secondary that are managed by the central government. And therefore, this has disadvantaged some of the children because if a county is mismanaged or there is corruption or lack of concern for educational development, we have cases where children continue to run under trees simply because maybe the governors or the county governments in those areas are not willing to invest in early childhood education. Also, the hiring and the training of teachers have been lagging behind in some counties. And I believe that is a very serious equity issue because we have some where it is so developed, other regions it is lagging behind. So although the government is also trying to put in place some affirmative actions, I believe the model that we have applied is not the best unless it is enhanced. As such, we can also say that when the counties are left to pay the teachers, there is no equity across the board. Some are paid well, others are not paid, others' salaries are delayed. And therefore, in the long run, there is a lack of harmony in the way early childhood education is developed in Kenya. So we have had such serious issues with the early childhood education. And I think the model that has been proposed is a very, very good one, the upscaling model. So for us, that is what we are trying, but I think it has its own advantages and disadvantages. Thank you.
Thank you so much, Doctor. Actually, I'm particularly interested in your experience, and I hope it will be of interest to anybody as well, because we have actually at UNICEF we have tried to see what and to actually analyze, you know, the impact of decentralization, particularly education, decentralization on the performance of the education systems. And we have seen lots of actually good practices, but also, hearing from you on the fact that sometimes it depends on leadership, of the governors or, the education staff at the district level or regional level. but also the resources that are affected, the capacities and so on. But this is very interesting to hear from you about, that sometimes actually it triggers some inequity in terms of in lack of harmonization. But maybe over to you, David, if you have any comment on this particular, what has been your experience going through the different countries on this?
So, Dr. Florence, you raise a very valid issue, especially devolution and its implication for quality. And that we've seen in countries where there have been attempts to devolve pre-primary services. What are the critical issues we've seen? So I will give you some challenges we've identified. One is on issues of regulations, right? In cases of devolution, we've seen that regulations have not been consistent across devolved areas. In some areas, there are regulations around the registration and certification of service providers beyond the government. And in other devolved areas, there are no systems of registration and certifications, thereby creating an imbalance in service quality. The other issue we've identified has to do with workforce, like you mentioned, where in one devolved area, the quality of the workforce varies, the compensation of workforce varies, the motivation of workforce varies from one setting to another. So what have we been able to do and working with countries in cases like that? One, in the framework for quality, there are standards. So in cases where pre-primary is devolved, the central government can basically work on having standards. We call them quality standards that they can hold devolved locations accountable. So one, we have the early learning and development standards. So we also have the service quality standards. We have the system efficiency and effectiveness standards. We have the parenting standards. We have the workforce standards. So the workforce standards would address all those issues about being on the payroll, the compensation classification, the motivation packages, that addresses all of that. And then we also have what we call the regulatory standards in terms of what systems and processes state governments must go through to certify those who provide pre-primary services outside of government. So once we standardize, once we agreed as national government on those standards, working with the states and define our standards and put our standards in place, that's where national government can now hold state governments accountable for the implementation of the standards to ensure quality at scale. That's just one fundamental approach that can be used.
Thank you. Thank you so much, David. I think, as you said, I suppose the central level still, has a role in all of this, as you are explaining, in terms of regulation, setting standards, and so on. What we have seen as well, in this study that we are about to release as well on decentralization is also that there are some good effects as well, good consequences, and particularly not applying a blanket approach. So the now decentralized the region, the governors or the district authorities are able to allocate resources depending on the region or the district needs. And that is so important. I suppose in Kenya, the context is very different from north to south, probably, having a level of responsibility authorities and adjusting the approaches is key. Thank you very much. I would take maybe a last question before we can start wrapping up, let's say. I have seen a question particularly on indirect cost, whether have you taken into account those indirect costs in your analysis, particularly the cost-effective analysis? If you want to take this one, David, before we can close, or any other relevant comment that you want to do based on the question that you have seen. Over to you, David.
So I will come in on the indirect cost. Could we just permit Camilo Marco Jr. from Mozambique to talk about the ASR program and the advocacy measures that have been used to get government buy-in and where they are currently? Camilo, are you there?
I see you have been able to now unmute. Please go ahead.
Hello.
Yes, we can hear you.
Okay, thank you. David, can you come again with your question because I didn't get it very well?
So basically, I wanted you to share light on the advocacy interventions that have been made around the accelerated school readiness program, and what results have you achieved and where you are in the process of scale.
Okay, thank you. I just wrote something and question in Q&A there. I think you can see some information from us, but I'm happy to share that after the piloting the program with UNICEF funding, we managed to scale up to other provinces, especially northern area of Mozambique. And then we produce different ingredients and also advocacy message, including video. The video that we engaged, the decision makers, the beneficiary, and also the school director, and all education entity at different levels. So we use these ingredients, to present and discuss in different forum along 3 years, almost effective 3 years. But this exercise has brought a great result because now we have a buy-in from the government, and then we are advocating. The government now is advocating it, to allocate, the education budget, to scale up the ISR program. So what we are doing now, we'll start soon to work on a scale-up plan, and we want to develop a very, very clear scale-up, maybe for 5 or 10 years, so to make sure that, the program can be implemented in phased, form. And we will need really your support, especially from our regional office on the costing component of this. So I'm taking the opportunity, to request your support on this, and then we will keep you updated on the progress, and then the steps that you may need to come in. And we are also happy to share, the impact evaluation report if you want, and other participants here might be interested on reading this, but also to have, a discussion or bilateral discussion if needed, so we can share our experience on what we are doing, on scaling up the program, especially on advocating it to have different funding, to support the program. Just to finalize, we are happy also to share that we have some NGOs working. One of them is Terre dos Hommes Italia, which started to implement the ISR program. So we're happy with that news, because the program is receiving buy-in not only from the government but also from other partners. Thank you, and over.
Thank you so much, Mozambique team. Okay, your last word, maybe, David, before we can go to maybe Veronica for the result of the survey, and then to Victoria for the closing remark. David, your last word?
Thank you, Camilo. I just want to say in my last word that advocacy is critical for scaling up interventions, and we cannot mobilize resources, partners, if we don't have a clearly defined advocacy strategy. around this. And for example, in Mozambique, the advocacy was robust, working across different angles. They also had a national quality conference where we were invited by the government, and we made a big case for pre-primary education that also stimulated some of the conversation. So when it comes to indirect costs, based on the question asked by one of our colleagues, there are, depending on the country and the model, there are different indirect costs. So for example, if a model does not have nutrition and school feeding, then of course, nutrition and school feeding becomes an indirect cost. That is also a personal cost to the family. And then there are countries that require school uniforms. There are countries that require, for different models, may require teaching and learning materials that are not part of the package that is provided by the model. Those become indirect costs. Another indirect cost is based on the location of the service provision. So sometimes transportation, if it is not within the community, can become an indirect cost, like we see in many countries, that also undermine access. So there are different indirect costs, but what we're going to do is to put a framework for indirect costs in the scale-up framework that you can see, and what mitigating measures can be used. Finally, colleagues, pre-primary education is about the future. And the most we can do for children of the future is to ensure that they have the right start. And having the right start means we need the right enabling environment. Having the right start means we need the right systems. Having the right start means we need the right approaches. Having the right start means we make effort for advocacy. And having the right start means we advocate for domestic financing. And having the right start means that we change the story from the beginning. That's the only way we change the story at the end. Thank you.
Thank you so much for your advocacy today. You have been amazing. Thank you so much for this an hour and a half that we have spent with you, David. Veronica, please tell us what colleagues in the call have said through this survey.
Thank you so much. I think I'm having a problem with sharing my screen today, but so far we've received 19 responses from different countries, and majority of the respondents are from the Ministry of Education, which is quite encouraging. And checking on the pre-primary models that are implemented in the countries, majority of the countries have a 3-year pre-primary model, then followed by the 1-year annexed pre-primary model, amongst others. And then also checking on the request from country offices on technical support in development of the scale-up plans. 15 respondents say that they would require technical support from UNICEF and the KIX Hub to develop these scale-up plans. And also some of them would require on-site kind of support compared to remote support. So thank you. And we're going to share these survey questions as we share the resources for the webinar, so that we can still continue getting information from the country offices. Thank you.
Thank you very much. So just a few points from my side before giving the floor to Victoria. As you know, the KIX community of practice is, iterations of meetings, so that we can learn from each other, and then we are coming together again, maybe in some weeks, and then we come back, and then others will be sharing. So today it has been kind of the start, because of this community of practice, even though we had other meetings in 2024, but because we wanted to start with the presentation of the scalability framework, so that it enables us next time to come and give the floor to some countries that will actually share their experience. So we are happy to kind of get started with this community of practice in 2025. I have also heard lots of opportunity for country support through David expertise to support countries in developing their own scalability action plan. I have heard also some proposal around maybe South-South cooperation between Somalia and Liberia. We are also in a position, maybe if you feel in your countries to be supported in terms of, bringing stakeholders together, we can also support as KIX 19 some policy dialogue. There were lots of questions around, how to bring international partners, community, government counterpart, and so on. So that is something that KIX can also support the countries to do. So with this, I think I would like to just give the floor to our own Victoria, senior program at UNESCO ICBA, but also our coordinator at KIX 19. Over to you, Victoria.
Thank you so much, Helene. And wow, what a beautiful session you've just had. And David, thank you so much. We truly appreciate, and kudos to the UNICEF team for organizing this. Thank you, Helene. Thank you, Veronica, through the leadership of Wangani. And thank you so much, even our moderator, Ray. Thank you so much, everybody. And so, distinguished participants for this session, the Committee of Practice is the beginning of an interesting time as we come to the close of this very, very insightful and engaging session. I would like to express our sincere appreciation and thanks to each one of you for your active participation. I've been following the question and answer, forum. There were so many questions that were coming up, which are exhibiting the interest and quite thought-provoking, very interesting, valuable contributions within the questioning part. So I believe that there's more that we need to address even within the upcoming session. So we've explored quite a lot in this session, looking at the scaling of pre-primary education in Africa. We've looked at understanding the landscape. We've looked at the framework, and David took us through the different models and how cost-effective these are, which was quite interesting. And one major takeaway for me has been that scaling up early childhood education is not an option. We just have to pick up our pieces and move forward, because it's very, very imperative for securing the future of many millions of young learners, young children out there that do not even have access to ECE. So if we don't do it right at the foundation phase, then we're in trouble later on in the future. I liked your phrase that we don't build the house by starting from the roof. We begin from the foundation. Very, very provoking thought. So thank you so much, David. And you talked about the critical enablers, which were quite interesting. A lot of it in terms of us understanding that we need political commitment. We can't do without the governments prioritizing primary education. We need to strengthen our frameworks, the policies. We need to allocate budgets. We need to train our teachers. Very, very interesting enablers that you have talked about. We need to plan well. We need to contextualize, because it's not a one size fit for all. So I want to really say thank you so much. And colleagues from your various sectors, as you've been here online, as we move forward, let us translate these discussions into concrete actions. It's good to share these thoughts, but let us think about translating this into concrete actions. Let us work together, and as the KIX Africa 19 Hub, we're here to support you. And I really want to promise that let us know where you need support, because we will be willing to support you to strengthen your competences and capacities. So as I conclude, a special thank you to the KIX Africa 19 fraternity that is made up of UNICEF SRO colleagues and African Union and UNESCO ICBA. Really, thank you so much. Our countries and the KIX focal points from the Ministries of Education, thank you very, very much for your continued guidance and leadership in this. And I look forward to seeing more of these discussions. And thank you again, UNICEF. We truly, truly appreciate. Thanks, everyone, and have a great evening or morning, depending on where you're connecting from. Thanks. Bye-bye.
Bye, everyone. Thank you very much.
Okay, thanks. Bye-bye.
Victoria.